And welcome to the Organic MD podcast with Dr. Damon Miller. My name is Carlisle Koash. Hello, Dr. Miller. How are you doing today?
Hello, Carlisle. I'm actually good today. It's a nice fall day here. The sun is out. It's bright, and we've done really well this year. I'm not jinxing myself, but we haven't had a whole lot of wildfires in Northern California, not like previous years. So, things are looking up.
Excellent. Well, I believe the topic for this particular podcast is talking a bit about treating wounds with low-level electrical therapy, which sounds interesting. Not usually what we would hear normally if I have a wound and I need it to heal, but I'm guessing you have some insights.
Well, yeah, and it's not just my insights. I mean, I've seen this work a lot in practice, but we just wanted to say that these are the kinds of things you'd want to do, not because I recommend them, but because there's a huge volume of peer-reviewed medical literature that's looked at this and shown that, yes, indeed, low-level electrical stimulation with the proper equipment can accelerate wound healing. And this is really important because some of the wounds that have been studied and looked at and researched are things that are just a nightmare for physicians. So
like
non-healing...
Okay.
No, go ahead.
I was going to say, like what?
Oh, like what? Well, glad you asked. Like non-healing leg ulcers in a diabetic patient, or pressure sores, bed sores in someone who's got a spinal cord injury and, they don't get moved enough by their nurses and they develop pressure sores. And I don't think we have an article for this one, but one that's been studied and that I've actually used is there's a particularly nasty kind of spider bite you can get from a brown recluse spider. And the thing that makes it so nasty, it doesn't poison you. You don't fall down and die, but the venom that spider puts into you when it bites you basically shuts down blood circulation, and you develop this necrotic wound that won't heal. And it's a mess. And using the right equipment, we're going to talk about the equipment later, but using the right equipment, you can heal those wounds with low-level microcurrent stimulation, electrical stimulation therapy. And, I think the important thing just for this podcast, the takeaway is here's something you can do. And your doctor's probably not going to recommend it, even though they know about it, they've read about it, it's in the literature they're supposed to be reading, they have access to the equipment, but that's just not the way their brains work. It's not a drug.
I mean, my experience just working in hospitals and also working in hospice, we always had patients often had these different problematic wounds that would have a difficulty healing. Usually there's a process, right? Western medicine has a specific way to handle different kinds of wounds. Those aren't always effective. And so how is this kind of therapy, what is it doing that's different than the normal course, I guess? Like, what is it that makes it work more effectively than, say, a particular bandage or a particular kind of wound dressing?
Right. Well, some of the articles, we've included links to just a few articles, but some of them discuss just that very thing. Oh. So, if you have a pressure sore, the standard thing is, well, you try to move the person a little more so they're not just sitting 24 hours a day on that one spot. You put padded bandages on so that there's not as much pressure on the spot that's not healing. And then you cross your fingers and hope that it heals. The body will do the job of healing it. And what the electrical stimulation has been shown to do is it increases blood circulation. That's one thing. You don't have blood circulation, you can't get the nutrients in and get the waste products away. It increases at the cellular level, it increases energy production in the cells so that they can do the job they're supposed to do of, regenerating skin, regenerating tissue so the thing will heal. It increases the production of fibroblasts, which are the cells that grow across the open wound and the first things that come in to start the process of healing. And it increases after that the formation of cutaneous cells that cover over the fibroblasts, so you finally get healing. So it basically, it jump starts all of the natural things that the body normally is trying to do. It makes them work faster, better. And so you get accelerated healing. Just as an aside, it also makes the wound heal in a more cosmetically acceptable way. One group that uses this kind of technology a lot is the plastic surgeons. They have found that they can do an elective plastic surgery, and if they use the microcurrent stimulation after that elective surgery, it heals faster and with less scarring and with a more cosmetically desirable result.
Wow.
So it's used in elective things and in these kind of hideous cases of people with huge open wounds that won't heal no matter what you do. So it's good.
Do you think that there's a size limit in terms of like the wound size? That would it be less effective if it's a larger wound, or I mean, is it just consistently a good treatment?
Yeah, that's it. You know, one of the things that struck me in my training as a physician, you know, this isn't the kind of thing I deal with now, but in the training I had in the hospital, you see some pretty serious injuries, serious wounds, serious problems. And, you know, you have somebody shipped into the hospital from a nursing home and they've got this thing that's bigger than your hand on their backside that's, you swear it's going to kill them. And, you know, with careful nursing care and, you know, good care, it heals up. And, you know, beyond anything I would ever imagine was possible. And this is without microcurrent stimulation. I'm just saying the body has an amazing capacity to heal. And so I don't know how to answer that question. I mean, there's probably some limit that you can't go beyond, but I don't know what it is. You know, I've learned to just approach everything that, you know, it's not up to me to decide what's possible and what's not possible. I'll do the best job I can. And often I'm amazed at how horrible things heal up.
Exactly. It's worth it's worth the attempt, since it's a treatment that is, I would say, probably pretty low risk. Like it's not a therapy that's.
Yeah, I mean it gets a little complex in that you know, if you've got a really serious wound, sometimes things are needed, like, you know, removing some of the dead tissue and, you know, almost minor surgical procedures, you know, that because that dead tissue will become a growth medium for bacteria, and you can get bad infections that are hard to clear. And so it isn't just slap a little electrical stimulation in the area around the wound and hope that
For sure.
You got to have some comprehensive approach. You know, having a doctor involved is a good idea for a bad wound. But for more minor things, you know, like a spider bite or a small wound that's starting to form in a diabetic, these are things that are inexpensive, very, very safe. People can start it at home. You know, you don't need to spend weeks in the hospital to get this done. So it's, you know, it's really got a lot of things going for it. Very few downsides.
And you had mentioned, now there are, because it's the stimulation that's needed is fairly low current. So are there particular machines or things that people can use? Like what would you use that would produce that level of?
Yeah, well, you know, again, the answer is a little complex, but I'm going to keep it simple and keep it brief. The answer to that question. One of the things that makes it complex is that these are, you know, the FDA doesn't approve these units, but the Federal Food and Drug Administration, the FDA, oversees and regulates the production and use of this kind of equipment. But as far as the FDA is concerned, if it's a little box with a battery in it that's putting out some kind of an electrical signal, all the units are the same. So you can have a simple thing called a TENS unit that you can buy in the drugstore that has a couple of capacitors in it and puts out a very, you know, kind of simple waveform that is a counter irritant sort of therapy for certain kinds of pain control. And it is absolutely useless for wound healing. Or you can have a more sophisticated unit that's run by a microprocessor, has a complex waveform, tight regulation of the current output, just a number of things. And those are the kinds of units you need, but those are prescription units. So you need to get those from a doctor or a practitioner who can prescribe them. One person, an orthopedic surgeon, back in the 70s, starting in the 70s, he was doing work with actually regenerating limbs in mammals. He would cut the leg off a rat and get the leg to grow back using this kind of therapy.
Crazy.
Yeah. I mean, and there was just in the 90s, no, not the 90s. It was just the early part of the 2000s. People, this was all published in Scientific American, Nature, the journal Science. I mean, this was wild stuff when it was published. And people began to look at that, and it's kind of old. And I go, well, did he really do that? Did he really regrow limbs? And so they recreated his experiments, and sure enough, you can regrow a limb on a rat that you cut off. And so, if you can regrow a limb on a mammal, you can certainly help a wound heal, and do a lot of other things. But I mention him because he had the experience. He developed this as a research project, and then he developed an instrument to do this, but he was eclipsed. His business was kind of shut out by, once he'd done this, gotten it licensed, bigger companies came along and said, wow, this is amazing. This is going to make us a fortune. And he was just one small guy with his own little private company, and he made a great machine, and other big companies came along and tried to duplicate his machine, and they didn't do a very good job. And so even today, this kind of technology is used by the orthopedic doctors for non-healing bone fractures. You probably know people, young people, healthy people, they break a leg skiing or something and it just won't heal. And, or they break a leg in their foot and it won't heal. And, they go in and they do surgery and they put all kinds of pins, but this electrical stimulation will actually heal non-healing bone fractures. But in the orthopedic community, you've got sort of two camps: people who were exposed to good technology, say they don't understand how you practice orthopedic medicine without these machines, and people who were exposed to lousy technology say it's all a bunch of crap and it doesn't work. And so you need a machine. Just to cut to the simple answer, we've settled on a unit produced by a company called MicroStim. They market their units because this is what they're limited to. They market their units for pain control, but they make a very good unit that works for supporting regeneration. And in fact, one of the best ways to deal with most pain is to actually heal the tissues, heal the wound, heal the injury that's causing the pain, and then the pain goes away. So not just suppressing the pain, but healing the tissues. So microstim.com, microstim.com, you can find that unit described. You can buy it there. That's what we've settled on, because it's a workhorse, it's durable, it's works really well, and it's the cheapest one on the market. So it's got everything going for it.
And it sounds like it's using a complex waveform. So, I mean, a regular, say, a TENS unit you bought at the drugstore isn't going to regrow a limb, but these units that are operating on a more complex waveform, that's what helps make that happen.
Exactly. Yeah. And also not just the waveform, but how tightly you control the current. That's more than I need to get into, but if you're putting current through tissue, it's difficult to maintain a constant flow of current. If you're putting current through a copper wire, it's trivial. You can have the current be just a total flat line, but if it's tissues, the electrical properties of the tissue actually change as you treat them. So maintaining current output is hard, but these machines, are testing the resistance in the tissue 1,000 times a second and adjusting the current output to keep it constant.
I think your canine friend Max is chiming in, agreeing maybe.
No, he wants it's time for his microcurrent treatment. Actually, a lot of this stuff was originally developed by the veterinarians, but because it's
so he's hearing microstim.
Yes,
he's like, yes,
my microstim.
Yes, I remember. Hey, I got some sore hips.
Okay, well, and he's also telling me to get off the phone and go walk him. So I think we're good today. Okay, right. Thanks, Carlisle.
Thank you. And check out the website. If you have any questions, you can always send us a message and we'll do our best to respond. Have a wonderful day.